Hi, welcome to James A. Haley VA Psychology Internship Program. I am Dr. Steffanie Canada.
I'm Dr. Steffanie Sciandra.
And my name is Dr. Julie Cessna.
We are the primary clinical supervisors for the spinal cord injury rotation here, located on the main hospital campus. Our SCI program is one of 25 SCI centers nationally. Tampa SCI is the third largest and busiest program in the country. There are over 17,000 patients in the SCI registry, with nearly 1,500 in the Tampa catchment area. We have an MS Center of Excellence that serves over 400 patients, and we also have an ALS clinic that is considered the largest ALS registry, serving over 225 patients. Tampa's SCI program is divided into 4 clinical areas. We have a 100 inpatient bed unit that consists of a vent weaning unit, acute rehabilitation, medical surgery, subacute, and a residential long-term care unit.
Our outpatient clinic is based on a patient-aligned care team model and includes a team of healthcare professionals working together and coordinating care for patients and their families. Veterans can choose to establish with one of our primary care physicians for regular outpatient follow-up and care. Psychologists are involved in yearly annual evaluations in which the veteran meets with each discipline on the same day to identify care needs. Other disciplines involved include a nurse practitioner, nursing, kinesiotherapy, social work, pharmacy, and nutrition.
In addition to the outpatient clinic, our center offers an accredited SCI home care program. There are several specialty programs within home care, including the Home Care Progressive Rehabilitation Program, the Comprehensive Home Care Integrated Program, the Long-Term Care Coordination Program, telehealth, and hospital and home that provides a smooth transition from the hospital setting to the home and fosters hospital-like care in the veteran's own home, such as IV antibiotics, wound care, or respiratory therapy. Demographically, our SCI Center serves veterans across the age span, from as young as 18 all the way through the 90s. Our population is predominantly male, and you can see the ethnic breakdown illustrated here. As well, we work with a number of active duty service members, especially in the acute rehabilitation program.
Causes of spinal cord injury are generally classified as being traumatic or non-traumatic. Motor vehicle accidents and falls are the most common causes of traumatic spinal cord injuries. Other types of medical conditions can damage the spinal cord, including things such as tumors, autoimmune diseases like MS, ALS infection, and spinal stenosis.
The primary objectives of spinal cord injury are to provide clinical treatment and management of individuals who have sustained new injuries or have been living with an injury for some period of time and are returning due to re-injury, deconditioning, medical comorbidities that are associated with SCI, or illness that is affecting the spinal cord and physical cognitive function. Psychology's role is to help patients manage many of the emotional responses that can follow a spinal cord injury event or other medical event, and to help them through the initial adjustment phase, establishing their new normal, and preparation for transition home or to the next level of care and rehabilitation. SCI takes a multi, inter, and transdisciplinary team-based approach to patient care. Primary services can include, but are not to be limited to, medicine, mental health, pharmacy, nutrition, wound care, rec therapy, occupational speech and physical therapy, nursing, and voc rehab.
The types of psychological services offered include a wide range of both inpatient and outpatient services. We offer both in-person and virtual modalities for outpatients, and many prefer virtual care. Patients are often referred for psychological and neuropsychological assessments to evaluate any emotional, behavioral, or cognitive barriers to engaging in rehabilitation and managing their medical care. Types of conditions addressed also vary widely and may include adjustment difficulties, depression, anxiety, PTSD, substance abuse, insomnia, chronic pain, and cognitive impairment. Neuropsychological assessments are often focused on doing baseline and follow-up evaluations among those with MS. In addition, referrals also include differential diagnosis of dementia, delirium, and assessment of traumatic brain injury, especially among the newly injured.
So applicants often want to know, what is a typical day like? A day in the life of an SCI intern will include a lot of meetings, collaborating and consulting with other disciplines, inpatient and outpatient evaluations and therapy, which can be done via telehealth, face-to-face, bedside, or outside if it's the patient's preference. And also groups, which can also include mindfulness, caregiver support, ALS and MS support, and SCI education groups.
Good luck with your interview process, and we'll be happy to answer any questions during the interview day.